Welcome to the Health Minute. In today's video, we'll talk about a topic that can save lives: the 7 symptoms that precede a stroke. Recognizing these signs and acting quickly can make all the difference. So stay with me until the end. And don't forget to subscribe to the channel for more health-related content. Did you know that a stroke, also known as a cerebrovascular accident, is one of the leading causes of death and disability worldwide? Recognizing early signs can save your life or that of someone close to you. In this video, I will explain the 7 main symptoms that may precede a stroke, the types of stroke, and the risk factors. Stay until the end because this information could be life-saving. A stroke occurs when the brain stops receiving blood and oxygen, leading to the death of brain cells in just minutes. There are 2 main types of strokes: ischemic stroke, which accounts for about 85% of cases. It happens when a blood clot or fat deposit blocks blood flow in an artery that supplies blood to the brain. Think of it as a blocked road. Hemorrhagic stroke, less common but more severe, occurs in 15% of cases. This type is caused by the rupture of a blood vessel in the brain, resulting in bleeding and increased pressure inside the skull. Now that you know what a stroke is, let's discuss the most important symptoms that may appear before a stroke. Weakness on one side of the body is one of the most common symptoms preceding a stroke. It occurs due to interrupted blood flow in a specific area of the brain responsible for motor control, the motor cortex. Ischemic stroke. A blood clot blocks blood flow, depriving that brain area of oxygen. Hemorrhagic stroke. Bleeding in the brain increases intracranial pressure, compressing areas controlling muscles and impairing movement. Key signs: the person may struggle to hold objects like a cup or pen. When trying to lift both arms, one arm may drop or feel weaker. Facial asymmetry occurs because the facial nerve, responsible for facial movements, is affected. When blood flow to areas like the motor cortex or brainstem is interrupted, the facial muscles fail to receive proper commands. Result: one side of the face may become paralyzed. The person may have difficulty smiling, blinking, or moving their mouth. Quick test: ask the person to smile or show their teeth. If one side of the mouth droops or remains immobile, this is a clear warning sign. Slurred or incoherent speech is a typical symptom when a stroke affects areas of the brain responsible for language, such as Broca's area in the frontal lobe or Wernicke's area in the temporal lobe. Dysarthria. The muscles of the mouth and tongue lose coordination, causing slurred speech. Aphasia. Difficulty in finding words or forming sentences due to impaired language processing in the brain. Key signs: incomplete or confusing words, speech that is hard to understand. Quick test: ask the person to say simple phrases like, "Today is a beautiful day." If they struggle or the words are jumbled, don't ignore it. 4. Sudden visions loss. Sudden vision loss can occur if the occipital lobe, responsible for visual processing, or the optic nerves are affected by oxygen deprivation. This may also happen if the carotid artery, which supplies blood to the brain and eyes, is blocked. Symptoms: blurred vision, blind spots, a sudden blackout in one or both eyes. If vision becomes blurry or you notice sudden loss of focus, seek medical help immediately. 5. Severe headache. A severe headache is more common in hemorrhagic strokes, which occur when a blood vessel bursts, causing blood to spread in the brain. This irritates tissues and increases intracranial pressure. This pain is often described as the worst headache of one's life, appearing suddenly and intensely. It may also include nausea, vomiting, or even loss of consciousness. If someone complains of this type of headache, especially without an apparent cause, don't ignore it. It's a critical warning sign. 6. Loss of balance or coordination. When a stroke affects the cerebellum or brainstem, which control balance and coordination, the person loses the ability to stay stable. The brain cannot send correct commands to the muscles, resulting in instability and difficulty walking. Key signs: stumbling, unexplained falls, a strong sensation of dizziness. Quick test: ask the person to stand and walk in a straight line. If they stagger or lose balance, seek help immediately. Mental confusion occurs when the lack of blood flow affects brain areas responsible for cognition, such as the frontal lobe and hippocampus. The person may appear disoriented, fail to understand what's happening, or struggle to answer simple questions. Key signs: the person may not know where they are or the current day. Responses may be incoherent. Quick test: ask simple questions like, "What day is it?" or "What's your name?" If the answer is vague or confused, seek medical help immediately. If you notice any of these symptoms in someone, act immediately. In the case of a stroke, every minute counts and can make all the difference. Call emergency services as quickly as possible. Keep the person calm and seated to avoid falls or other accidents. Note the time when symptoms began. This information is crucial for doctors to determine the most appropriate treatment. Remember, acting fast can save a life. Now you know how to identify the 7 symptoms that precede a stroke and the most common risk factors. Share this video with your friends and family because this information can save lives. If you liked this content, leave a like, subscribe to the channel, and turn on notifications for more videos about health and well-being. See you in the next video.